Okay, good afternoon. My name is Joseph Phillips, and today we'll be doing an assessment on the mouth, nose, and throat. So before we begin this procedure, we'll have already identified the patient's name with their armband, name, date of birth, verify we have the right patient. We're explaining the procedure to the patient, answering any questions if they have any, and then if not, we're going to go ahead and begin the assessment. So the first part of our assessment is going to be inspecting the nose and the sinuses. So the nose, we notice that the nose is midline, the color is pink, there's no obvious lesions, there's no piercings or any kind of abnormalities noticed on the nose. From there, we're going to go ahead and move on to the sinuses, the frontal and the maxillary sinuses. So frontal and then maxillary sinuses. So we're going to palpate them for any kind of tenderness, no obvious tenderness, and we're going to percuss them. Right, they're tympanic. All right, so then the next thing that we'll be doing from here is we're going to be looking at the internal nose, the mucous membranes, and for that we'll be grabbing a light. Okay, just have you raise your chin up. I didn't say it, but the best position for the patient is going to be sitting upright or erect for this assessment. All right, so we'll be looking up into the nose. Okay, the septum is midline also. There's no deviation noted. There's no lesions. There's no excessive secretions or mucus from the nose. Will you go ahead and breathe in deep through your nose for me? Okay. The nose sounds patent. All right. Breathe in again. Okay. Breathe in again. Okay. Both nares are patent. And then for the next thing we're going to do is we're going to test the cranial nerve number 1, her olfactory. Some good old coffee. Okay. Take a deep breath through your nose. Can you smell that? Okay. Great. Set that back over there. All right. So then we're going to be moving on down to the mouth. In the mouth, we're going to be looking at the lips. So we're good with the lips. The lips they appear to be plump, moist. She appears to be well hydrated. There's no lesions, there's no cracking, there's no drainage or wounds, there's no malformation of the upper lip, like a cleft lip or anything like that. So that's great. From there, we're going to be looking at the teeth colors and the color of the teeth, the cleanliness, the color, if there's any kind of veneers or appliances, or if they're missing or cracked teeth. All right, so take a look at your teeth. Would have had gloves on, obviously. Alright, so she doesn't appear to be missing any teeth. The teeth's color there's a light yellow to the teeth. It appears to be normal. There's no excessive debris, hygiene, oral hygiene as well. She does have a cap on her first molar left upper and also first molar right lower. Everything appears to be appropriate for her age. All right, and then from there, we're going to be looking at the tongue. We're going to have her stick her tongue out, and we're going to be inspecting the tongue. All right, go ahead and stick your tongue out for me. All right, the tongue appears to be well hydrated. It appears to be smooth. It's free of any lesions or wounds. All right, that's good. And now we're going to look at the underside of the tongue. Okay, stick your tongue out for me. Okay, grab it, stick it out. Alright, up, stick your tongue up. Alright, we can see the salivary ducts, Stevenson's duct at the bottom. They appear to be excreting saliva as we're doing this inspection. Frenulum is there, it is intact, it looks normal. There's, again, like I said, there's no wounds or any kind of signs of injury or anything like that. Go ahead and stick your tongue out again for me. Open your mouth. Stick your tongue out. Open mouth. I need you to open your mouth. There we go. Stick your tongue out. Looking at the sides of the tongue. Again, there's no type of lesions or injury to the tongue. Restraint. Go ahead and stick your tongue out. Pull your tongue back. All right, left and right. Raise your tongue up. All right, so she has good strength. Checking cranial nerve number 12. It appears to be intact. Next thing we're going to do is we're going to move on to inspecting the throat. Again, the throat, we're going to be looking at the tonsils. We're going to be looking, assessing is there any halitosis, is there any on the tonsils, do they appear to be inflamed, normal, any exudate, any stones, tonsillar stones, any yeast, anything abnormal that may be indicating a potential problem. So again, we're going to need to use our light, and possibly our tongue depressor. All right, so open your mouth for me. Okay, stick your tongue out, straight out, and say ah. Okay, I can see the uvula, I can see the tonsils, the color is pink, everything appears to be moist, there appears to be no injury or inflammation, no tonsillary stones, no exudate, no drainage, no kind of yeast or anything like that. Alright, oops. I'm going to be checking her gag reflex. Open your mouth again. Okay, appears to be intact. Alright, go ahead and swallow for me. Hold on 1 second. Swallow for me. Okay, she's able to swallow with no problems. We inspected the tonsils, the size and shape were normal, the color was pink. Like I said, there was no wounds or anything in the mouth, there was no injury noted, or evidence of trauma, anything like that. Grading the tonsils, they would be normal. And that's going to conclude our assessment of the mouth, nose, and throat. Thank you.